This video was made to educate women on their options for pain control during labor. We realize that many options exist and that many patients are not aware of them until they arrive at the hospital in labor. Here we will present you with the different options that exist, and we hope to answer some of your questions as well. We also know that women may have many fears about receiving pain medication during their labor process, and this video is aimed at relieving some of those as well. At the end of this video, we hope that you will have a better idea of the choices you have for controlling pain during your birth, so that you can decide what choice is right for you.
Whenever patients come in, we're always happy to talk to all patients about their options for pain control during labor. Sometimes patients have a good idea of what they want when they come in, and sometimes patients have no idea and they want to talk about all the options. So certainly no pain medication at all during labor is the first option. And some moms don't need anything. Some moms want to have the entire experience with no medication at all, and that's absolutely fine. And some women want just a little bit of intravenous pain medication. So that's when medicine gets put into the IV that they already have, and they can get that generally earlier on in labor, and some women do fine with that. Some women do great with just a little bit of intravenous pain medication.
An IV will be placed into your arm when you arrive at the hospital, regardless of whether or not you elect to receive medication. The nurse will use this IV to give you pain medication when you ask for it, and you may receive repeat doses every 1 to 2 hours as needed based on your pain.
So intravenous pain medication, the side effects are generally a little bit of dizziness or sleepiness for the mom and for the baby. So anything that goes in the IV goes both to mom's brain and then to also baby's brain. So that's one of the side effects, is just a little bit of sleepiness. Generally that's not a big deal. If it's early in labor, then it's actually nice for mom to get a little bit of a nap. But certainly later on, as labor progresses, we can't really give too much IV pain medication anymore, both because we don't want mom to be sleepy and we don't want baby to be sleepy. Another side effect of IV pain medication is maybe some nausea, and that's about it. So sleepiness and nausea are the two main ones that people talk about.
Your second option for pain control is an epidural. In preparation for the epidural, the anesthesiologist will position you on your bed, either sitting up or laying down, so that your spine is curved outwards. This allows better access for the epidural to be placed. Next, a sterile drape will be placed and your back will be cleaned thoroughly to prevent infection. You will first receive a small amount of numbing medication in your skin, and then the epidural will be placed. The entire process may take as little as 5 minutes. Once finished, the epidural catheter will be left in place and taped to your back, where it will remain until you deliver. This allows the anesthesiologist to adjust the amount of pain medication you receive. An ideal epidural allows for minimal pain during labor, while still allowing the patient to feel her contractions and push effectively.
Some women would like to have what we provide, which is an epidural anesthetic. So an epidural is basically, what I tell women, is medicine that goes in the back, and it usually takes about 10 or 15 minutes to place that medicine, and that medicine is actually delivered through a very, very small thin tube called the catheter, and that catheter stays with the mom the entire labor. So she generally only has to get this procedure once for the entire labor, and she can have it all the way up until the baby is born. In terms of the epidural pain medication, the side effects can be also some nausea. You can also get a little bit of itchiness. It's not an allergy. It's just a side effect of the medication that we give. It can give you a little bit of itchiness, generally mild. And the nice thing about the epidural medication, though, is that it really doesn't get to baby. So really only mom feels these side effects. The side effects for the baby are very, very minimal. The medication that goes in the epidural really doesn't get to baby at all. It doesn't really get absorbed into the bloodstream. It stays in the back where it works. And another side effect is that the epidural can potentially make mom's blood pressure a little bit lower. So we generally monitor blood pressure very frequently after the epidural's in, and we do have to monitor blood pressure throughout the labor. Generally, the blood pressure decrease is very mild, and we treat that with just giving a little bit more intravenous fluid, but sometimes we'll need to treat it with other medications.
Okay.
Do epidurals speed labor, slow labor? Because the overall impression by patients is that epidurals slow down labor. And there are really no studies that support that. If anything, there are some suggestions that epidurals, if given early in the active labor phase, actually may speed labor. And that's due to relaxation of the muscles. It's also due to, there's a lot of biochemical explanations of why contractions get stronger. But the bottom line is they don't, epidurals don't tend to slow labor, and if anything, may actually shorten the labor process. Next question people always ask is, does it increase the risk of C-section? And there are no studies that suggest that that actually happens. So for the most part, C-section rates happen and epidurals happen, and one affecting the other doesn't seem to be shown.
I consulted my doctor about it, my prenatal care doctor, and she gave me more information that even if you don't have an epidural, because the expansion of your pelvis, and that's harsh on your body already, that regardless you'll have pain on your back after the birth because of that. So
That's a lot, and with good reason, because obviously we're working in the back, and so the kind of maybe the natural logic would be that it causes back pain. But you know, there's been a lot of studies, a lot of research done on the subject, and I can definitively tell you that research does not support epidurals causing long-term back pain. Women who get epidurals, and so pregnant women who get epidurals and pregnant women who do not get epidurals and have their babies have the same exact incidence of back pain. So what I usually tell moms is pregnancy can cause back pain. So you have, you know, a lot of heaviness, you have, you know, obviously a lot of weight to carry during the pregnancy, so pregnancy itself can cause back pain. Certainly the epidural, when it goes in the site at the skin where we put the needle, that will hurt for a couple days. It's just, I describe it to moms, it's just like when you get a flu shot or any shot in the muscle, you know, it hurts for a couple days just because you've introduced something foreign into that muscle, and so your body kind of gets, you know, a little bit annoyed. But certainly that little pain should go away after 2 days, and it does not cause long-term back pain.
It's always asked, when should I get an epidural? And I always give the standard pat answer that before the head is out. There is no right time to get an epidural. It's when you're hurting, and unless there's a real medical contraindication such as bleeding problems, etc., epidurals should be given whenever you want it. Now, if you're not in labor and you're not hurting, it technically may be a little more challenging for the anesthesiologist to do it because they can't test the epidural to see if it's in the proper place and whether or not the epidural is functional. So it really helps to have somebody contracting, and if you're not in labor, if you're in the prodromal labor phase, in that situation epidurals may slow the process down. But for the most part, epidurals are safe, effective, and to deal with the complications, you really need to talk to an anesthesiologist. But in our long clinical experience of lots and lots of patients, the risks are low, the benefits are high.
Like, it doesn't hurt as much as everybody says it does, but it's just because they couldn't find like the right spot, so they poked me like 5 times, and then it's like, it's not really that bad though because they numb you first. So it's not what everybody says. It's crazy, it hurts, and it's hard to stay still. Like, it's hard to stay still because of the contractions, but they help you. They talk you through it.
Okay. And how did it change your pain?
Oh, that was a good thing.
Made it a lot better.
Oh yeah. I couldn't, like you don't really feel anything. Like, a contraction kind of just feels like you don't feel anything, but like towards the end, Towards the end, like when he's starting to come out, like you feel it's just pressure, and that's a contraction.
Okay.
I feel that it's my duty as a mother to do what's best for me and my child, and the epidural did allow me to, go ahead and stop stressing, or I was able to breathe and, not worry about the contractions I was having, which was actually putting pressure on my baby. So when you become a mother, you have to do whatever you can to, make sure that what's best for your baby. So I feel like I would probably be less of a woman if I would have took it because of, things I've heard before.
Mm-hmm.
You have to make your own decisions, and I think I made the right choice.
Great.
Thank you for taking the time to watch this video. We realize that no one choice for pain control is right for everyone. However, we hope that you now have a better understanding of the different types of pain control you can use during your labor, so that you can decide which choice is right for you.